So I am going to talk specifically about Asian schistosomiasis. There is schistosomiasis in Africa and South America, and also re-emerging in France and Spain in Europe. So it's certainly not a disease that's going away anytime soon. There are three different species that are mainly occurring in Asia. We've done a lot of work on Schistosoma japonicum, which is in China and the Philippines. But for the project I'm going to talk about today, we're looking at Schistosoma mekongii, which is in Cambodia and Laos, previously in Thailand, and potentially in Myanmar as well, where there's some work needed there to just, see which species we're talking about. So this is just a basic overview of the life cycle of schistosomiasis. We won't go in any great depth, but we have the adult worms hanging out in the mesentery of the bowel. They release eggs, which work their way through to the gut and are released in the feces. These eggs hatch on contact with water, releasing a myricedia, which then infects our snail. So snails are a very important host because they're amplifying hosts. So you get one myricedia that goes in, and then you can get hundreds to thousands of cercariae that come out because they're undergoing asexual reproduction when they're in that snail host. It also makes the disease very focal. So you can have villages next to each other, some of which have very high infection and some which won't have infection at all because of where these snails are. So the cercariae penetrate the skin of the humans directly. So you can get this cercarial dermatitis as your initial sign of infection. They then migrate through the body, maturing and becoming adults. More severe diseases occur when you get eggs trapped in the liver. These eggs don't have GPS systems, so they don't all end up in the feces. Some of them end up in the liver and the spleen, and they cause these liver granulomas, which you can think of as sort of space-occupying lesions. And so you end up with these very fibrotic livers and spleen, and you can end up with hepatosplenomegaly, so grossly enlarged spleen and liver, like this young boy here. You can get portal hypertension as well, and you can see as evidenced by those veins that you can see on the stomach of the man standing there. And more insidiously, particularly in children, you can get growth and mental stunting. So I'm going to be talking about this project that we have going on in Cambodia and Laos at the moment, which is looking at developing new tools to try and eliminate the disease there. So it was written under a climate change call, and because of that snail host, it is very much going to be affected by climate change, and both dry and wet climate change models will impact. So in dry climate change, we may be looking at increased transmission, whereas in wet climate models, we're looking at potential increased dispersion. And we also know from one of Darren's earlier studies that wasn't supposed to be in a schisto-endemic area of Cambodia. It might actually be a new foci of schistosomiasis in the country, which we're going to explore further. So there's been years, decades of MDA for schistosomiasis, and still the disease is persisting. So we need to do something more, which is what this project is about here. So developing our new diagnostics, but also looking at health education interventions, wash in building latrines, and also looking at environmental DNA detection to look for where the snails are and where the snails are and the parasite is, so we can see where the risk areas for transmission are. So this is our project plan. We have completed the pilot study in 2024 and early 2025. We're about to start the baseline survey very soon. And in a year, we'll do the follow-up survey as well. And see, we have split our villages in each of the countries into our control, who are just going to get the normal MDA with praziquantel, and our intervention, who are going to get all of these tools that we're developing. After the follow-up, the control villages will also get the MDA, because that's ethical. So these are our study sites in Cambodia and also in Laos here. So these two study sites are basically either side of the Cambodian-Laos border, so very close to each other. So I've got a bunch of different diagnostics, the traditional microscopy diagnostics, got some summer semester students who have been helping to develop the qPCR for mekongii, and then to be developed, Peng Fei's working on the Geica, and we've got environmental DNA being done by our Japanese colleagues, Megumi, Marcelo, and Yasuhito there. So for the pilot work, we wanted to collect stool samples from animals. Schistosoma japonicum has 46 mammalian definitive hosts. Mekongii has always been a little less unclear about what animal hosts, if any, may be important. So this was a question we really wanted to answer. We also performed household questionnaires, latrine surveys, and informant interviews, as well as focus group discussions that will help to develop those educational interventions particularly. While we were there, we were also able to look and see where transmission points might be, so how humans and animals were interacting with the water. So remembering the water is where the snails are living, and contact with that water is how you were getting infected. So you can see we've got water buffalo obviously hanging out in the water. We've got these fishermen have come up, and you can see their customers are standing in the water. We've got kids swimming, and we also saw women washing clothes along there as well. Pigs have traditionally been considered hosts. Mostly they are kept penned, but this was a good example here. We had this guy penned. His water was coming from the river, and he's right on the banks of the river there. So as soon as it rains, you've got that pig feces and potential eggs washing into the river. So quite a nice, easy potential transmission there. And of course, some more water buffalo hanging out in the water there. So I stole these next slides from Rain, who put these together, but this is looking at the formative research procedures. So starting with our household questionnaires, one of the things we're interested in obviously is our water use, and this has gone crazy, but you can still kind of see that with drinking water, cooking water and washing water, they were primarily using river water for these activities. So one of the things we didn't ask, and we should have, and we will when in the baseline, is if they were treating or filtering that water before use. But this is an obvious issue and potential transmission there. This one looks slightly better, but still a little bit weird. We also asked about the presence of toilets, and you can see in some of our villages, more people didn't have a toilet than did have a toilet. And so obviously, if you don't have a toilet, where are you defecating? Out in the wilds, maybe you're a fisherman and you just pop over the edge. So we really need toilets so that we can stop humans contributing to that infection cycle as well. In Laos, it's a little bit different. For drinking water, they did mostly use bottled water, but again, for the cooking and washing water, it was still that river water that is largely being used there. Toilet was a little bit different again. Most of the households in Laos do have a toilet, so that's not going to be a concern for our study. But we are going to build toilets now in those Cambodian villages to at least bring them up to 80% coverage there. So we did the animal collections, and here's the team in Laos after a busy day, and they're fixing the samples for either microscopy or qPCR later. So with the microscopy, only one dog was positive, and when we did the qPCR, only 2 dogs were positive by qPCR. So that does again mean that it's probably more likely that it's going to be human to human, humans that are contributing to transmission. We also looked for other parasites, and there's certainly a lot of other parasites around, particularly that Ankylostoma selenicum that Richard was talking about, a little bit of Strongyloides, and a lot of Opisthococcus, which is a worm that can cause liver cancer as well. In Laos is pretty much the same. We didn't have any positive in the microscopy or the qPCR for Schistosomiasis mekongii, but again, we did have a bunch of other parasites that we're going to be looking at as well. This is Khan. He's the son of our Japanese colleagues, Marcelo Megumi, and he goes everywhere with them. And here he is helping them collect the water samples. So they were collecting water samples all the way up the sides of the islands or the banks, depending which village it was. And they test that water for the presence of the snail and the presence of the parasite. So if you have just the snails and no parasite DNA, then that is an area that could become infective. But if you have both of them together, that's an active transmission spot. And so the idea is then to make these maps where we can map where the risk areas are and where future risk areas might be as well. So the next steps, we're going in to do the baseline. So we will be building the latrines in the Cambodian villages that require them. We have the health promotion materials, which are still being finalised. For the community health education, we will be doing community meetings with lectures. We'll be handing out pamphlets. So Mimi's helping me make some better images for this. So this will be better when she's had her hand in. And also doing posters, doing signs in the villages as well for information. With the children, we are developing a Magic Glasses cartoon video for schistosomiasis, and I think most people will be familiar with that from Darren and Rain's work on soil-transmitted helminths. These are some images from our storyboard, but again, this is still just being finalised and may change a little bit. And of course, chemotherapy. So we're going to treat the humans, and we're still going to treat the dogs, which along with pigs have traditionally been considered hosts, and we're still going to test these animals a bit more to see if there is still more schistosomiasis around. But I think I have finished bang on 10 minutes, so go me. If there's any questions, please feel free to ask them.